boy. Agree. Yeah. And in Phoenix, I felt for the ladies. Okay, today I just did a post on how a birth class changes pregnancy, labor, and birth with life with babies. So let's talk about the things. I took real examples of people who felt like they prepared well for labor. Robin said she's 18 weeks with her first baby. Robin, hang in there, girl. That's a rough time. Rough times. So what do studies show? The studies show that birth classes improve birth outcomes, they decrease birth trauma, and while classes can seem expensive, the average cost of a birth class is $187, mine's $89, and $307 for a bundled one. Mine is $198. You can still find affordable ones like mine. So a lot of things that people liked is they knew what to expect no matter what. One of the people said that when they were driving in their car to the hospital, they felt confident no matter how birth went that day. And I think that's really important because a lot of times people only prepare for I'm only prepared for an induction. I'm only prepared for a C-section. Like let's say you're going to go in and you're breech, but then you go in and baby's flipped. You're not prepared for vaginal delivery at all. That could be scary, right? Avery Ray says, just hit 8 weeks and feel great. It has my anxiety in an all-time high. Because you feel great or just pregnancy has your anxiety high? Yeah, I had high anxiety with it also. So I think it's so important to be prepared no matter what. So tell me in the comments, what are you prepared for? Are you prepared for all types of birth or just some types of birth? In fact, I have people who come in my prenatal class, the online prenatal class for couples, the easy way to get prepared for birth. And they just skip the C-section chapter. And I'm like, do not skip the C-section chapter, my friends. So make sure you're getting that in as well. Facebook. I'm so sorry. And Instagram. We're here still. It's a tenuous little setup I have going on here at my house, guys. I have a phone for TikTok. Everything else is on my camera. Cancel. Phantom pregnancy. I'm not so sure. Any experience with fetal blood transfusions? No, I do not. Avery, yes, the anxiety is due to me feeling great because I have no symptoms. Avery, I did not have any symptoms on my first baby either, really. I felt great. I was young. And I was like, what is everybody complaining about? Yeah, so he turned out fine. He was just here. He's 24. Well, he'll be 24 next month. Carol said, is it normal for a baby that is 2 weeks and 3 days old to drink 6 ounces of milk every 3 hours? Carol, I am not great at breastfeeding. 6 ounces seems high, but I don't know. Every baby's different, so I would ask your pediatrician. Yeah. Why do they do a D&C? It's just to clear out your uterus, make sure everything's gone. I read about mucus discharge. Is that safe or something to be concerned about? Normally it's safe. If it's bloody, then that can be an issue, but a lot of times your discharge will change during pregnancy. Kara said her 2-week-old drank 5 ounces. So there you go, Carol. What is a corpus luteum? I think it's something to do with the eggs. I don't know. Getting pregnant is not my thing. All right, we're heading back to how you can help have the best birth ever. One of the other things is I say laugh at what used to make you cry. If you guys aren't taking a birth class that's engaging you and you're just like, great, I got it done, I watched it, then that isn't doing anything. So make sure that you're taking a birth class that engages you, you find it fun and interesting. I really tried to make my class fun and interesting because I wanted you guys to enjoy it and have a great experience and also pay attention. Because some of these I'll see freebies online and they're just like, welcome to your magical birth. And I'm like, oh my gosh, I would never make it through it. I need to be engaged and having fun. So tell me in the comments if having fun in a birth class is important to you. What are some ways to induce labor already 4 centimeters? There really isn't any proven way to induce labor right away. Sorry. My best advice is to keep moving. Look up the mile circuit. Make sure you do that a little bit, but then put your feet up and relax. Take naps. You can do what you did to get pregnant, although they show that you have to do it repeatedly in the last month for it to really do anything. It doesn't usually just put you into labor, the studies. Some people will say it did put them into labor, but you never know if they would have gone into labor anyway. How to prevent a miscarriage early in pregnancy? There really isn't that much you can do. Yeah. Hang in there, Mariella. Okay, what are some other ways to make your birth better? Learning how the hospital works. In my class, I go over exactly what to expect at admitting. When you get in the room, they're going to give you a gown. That doesn't mean you have to wear the gown, but they're going to pop one on the bed. We just have them in every room, like already ready, so that when people come in, they're like ready. Then we're going to ask you 6,000 questions. A friend of mine just had her grandbaby this week, and she was like wanting to try and show up early, and I was like, don't get there early. Let them do the admitting process without you, because there's so many questions. I don't answer too much about periods, just about pregnancy. So knowing how the hospital works. A lot of people love how I talk about C-sections, how you're going to start in the triage unit or the PACU, then you're going to go to the OR, and then you're going to go back to the PACU, and what's going to happen in each of those different things. So the hospital works in a very different way than what you've ever experienced at the doctor's office or anything like that before. Most people coming in to have a baby have not had anything serious medically going on. So learning about how the hospital works, I think, can really help you out. Yeah. Caitlin said, my 10 weeks, and I've been having extreme anxiety. How do I calm that down? Do you mean you're 10 weeks pregnant, or you have a 10-week-old? Someone said they're 12 weeks pregnant and 17. I have nightmares almost every night. Are you having nightmares? I guess the question is, what are you nervous about? Are you nervous about delivery? Are you nervous about losing the baby? Caitlin said she's weeks pregnant. So, I mean, the best thing, hope. Like, hope is going to carry you through so much of pregnancy and birth and kids. There's a lot of times you just have to have hope that things are going to turn out all right. Tell me at the bottom if anyone is just like writing on health. Like, give us a like, because it just never gets any better. So you have to like learn coping techniques, do meditations, things you're grateful for. Those kind of things are really what carried me through so that I could manage it. On our last baby, I was super worried because we had gone through about 4 years of infertility and just so worried about losing it. And I was just like, there really isn't anything I can do, because as long as you're doing the right things, you're eating the rainbow, you're staying hydrated, you're not doing anything crazy with your body, you just got to see if it takes. Yeah. Yeah. There really isn't anything you can do, which is so annoying. Should I be worried they're saying my baby's stomach isn't measuring where it should be? It depends. Like, is the whole body not measuring adequately? That's the big question there. My sister's contractions yesterday, is that normal? It isn't unusual throughout pregnancy to have a contraction here or there. People think, oh, I've had a contraction, I'm going to labor. And I'm like, well, your uterus does these little practice contractions, or like when you do certain things, it'll contract. And so you just kind of have to ride with that and then see if you have another one. Usually you can ask your provider, like, how many contractions are okay or not okay. And so that's all you can really do. Usually, what I've heard most providers say is less than 6 in an hour. If you're starting to notice more than 6 in an hour, then you'll want to talk with your provider. And I'm hearing so many of you guys say that you're anxious and worried about things. I would 100% recommend talking with your provider. They can assure you that things are going well with your pregnancy. And if the anxiety is too much, you might want some medication. You might want to see a therapist. They might have a therapist that's good with these early pregnancy things. I don't know if you guys follow Mama Therapy here on TikTok, but I really like her. I think she's on other social platforms, although honestly, I'm not really sure. But 5 weeks, ultrasound only saw gestational sac. Is it normal? Too early? It probably was too early, although it could just be a sac and there isn't a baby inside of it. So you never know. On my first pregnancy, that happened to me. They thought I was further along. Last period was like, I don't even remember. But anyway, so my doctor, who was a real winner, brought me in and he goes, well, 50-50 chance your baby's dead, which I was like, okay. And my husband just like freaked out when we got out. But anyway, he said, we'll schedule another ultrasound in a week and we'll see if anything's there. And there was a heartbeat. So I was just too early because they can't see the heartbeat before about 6 weeks. 5 days past conception, usually you won't get a positive test, but I don't know. They said her stomach is in the 9th percentile, but the body is in the 51st percentile. So Ashley, are they going to do another ultrasound? Usually you don't see stuff like that just on one ultrasound. So check on the next one. Are they going to check like the contents of the stomach? Things like that. My 1 hour glucose was higher than normal range. What do you recommend? Are you taking the 3 hour glucose? seems like that would, I can't remember the numbers. Yeah, but I honestly think eating the gestational diabetes diet throughout pregnancy, even though it doesn't sound very fun, I felt so much better when I was eating that diet. So in that diet, which in the online prenatal class for couples, I have a nutritionist who comes in, and she talks about how to eat during pregnancy and snacks for labor and stuff like that. It's awesome. But balancing carbs and proteins and trying not to eat things that spiked my blood sugar, because I just think I was more prone to have blood sugar spikes during pregnancy. So, making sure I was like having apples and nuts, or just making sure that I had protein, and then I was trying to keep my carbs under about 40 for a meal and like 20 for a snack, I think. Ashley said she's getting another ultrasound Thursday. That's awesome. Anyway, I really think that eating the diabetic diet is going to make you feel the best. It, of course, takes away options from you because you can't eat anything you want. But I just think it makes you feel so much better. I'm 33 weeks today, and I've noticed movement decreased. Baby is not moving like it used to. If you're not feeling baby move like they used to, you need to go in and see your provider. But I always recommend that you guys are making sure to do kick counts. That's something that you can do at the same time about every day. If you have any questions on how to do it, you can check on my website, which is my link in my profile. You can see under free resources, there's a kick count cheat sheet that talks exactly about how to do them. But you're basically looking for how long it takes to feel 10 movements. So from, let's say you started right now, and at 5 o'clock my time, you had 10 movements, right? So that's taken 11 minutes. So tomorrow you'd want to compare. Is it taking 20 minutes tomorrow? Okay, so it's like 11 to 20, but then the next day it takes 30 minutes, right? And then you're gonna have an idea of like what things look like. And I always recommend to try and do it at the same time every day. I tried to do it after dinner. I would lay on the couch and feel for baby to move, and then I'd make my husband clean up the dishes. And so there were just so many benefits of it. And I loved sitting there and just focusing on the baby, because like when I was at work or things like that, I didn't do that very well. So 34 weeks today, and amniotic fluid is 32 today. Could it be problematic having excess fluid? Is 32 high? I'm not remembering. Range of AFI. Yeah, it is a little bit high. So that's called polyhydramnios. Are they going to check it again? Probably. I don't think 32 is where you like start to freak out. Yeah. So are they going to check it again? I think would be the question. How early can you have pregnancy symptoms? Most people really don't have them before 6 to 8 weeks, I find. Yeah. I don't answer HCG questions. It's just not my thing. You guys, I have twice weekly BPP, so they'll check again Thursday. Awesome. Yeah. So they'll see, is the fluid level going up? I have to say that as a nurse, there were ultrasound people that I trusted more than other ultrasound people. So yeah, sometimes their measurements, I was like, really? That's interesting. Maureen said, when do 2 weeks and 1 week appointments start? I'm 31 weeks and I don't have another appointment till 34 weeks. I think about 34 weeks you head into weekly, I think. It's the last couple months that you have weekly ones. So how soon can you see everything on an ultrasound? Usually they don't want to do the anatomy ultrasounds until about 18 weeks is when they'll start to see like heart, kidney. I don't know if they see the liver, intestines, lungs, brain, genitals. If you're looking for the gender, usually it's about 18 weeks. Usually they recommend that you take a pregnancy test at the day that you would like miss your period. Okay, in case you guys haven't met me, hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I am also the creator of the online prenatal class for couples, the easy way to get prepared for birth. And I'm so glad that you guys are here. Hopefully you'll give me a follow. And I would love to see you guys in my birth class, where we are talking about some of the benefits that people found. And one of them I call birth cramming. So I was always the kind of person that like when I would wake up before a final, I would like want to review all the information that I could before I went in to take the test. Somehow that just made me feel better. And I found that pregnant couples were wanting to do the same thing, either the morning before or while they were in labor. They just wanted to do birth cramming. Yep, 1997, Kale. I couldn't have delivered you though, because I didn't start labor and delivery till 2001. So I created key point videos for my birth class where you can go through these key point videos and learn the most important parts of certain parts of labor and delivery, so you can like cram it in if you'd like to. So a lot of people really enjoy that, and they felt like it made a better birth because they just like feeling that way. Like I liked feeling cramming before a test. Tell us in the comments if you like to do that too. So if that's something that you think you would find interesting, come join me in the online prenatal class for couples. Those key point videos are actually in the Bump to Bassinet bundle. Yeah. Let's see. My test for beta strep is positive. I'm 36 weeks and nervous. Can you explain what they'll do? Great question. So beta strep is a bacteria. Sorry, guys. That is commonly found in people's lady bits. Sorry, the lighting is so crappy. But during pregnancy, somehow they found out that it could lead to poor outcomes for babies that end up in the NICU. And so they started testing for it. And if you are positive, they will give you antibiotics while you're in labor, IV antibiotics. So we give it every 4 hours. That just like wipes the slate clean in the birth canal. And then 4 hours later, we give it again. Once baby's out, we do not give it anymore. So they have shown that helps babies not have issues when they go into the NICU. So the only thing that'll happen is you'll get those antibiotics. The big hope is that you can get them at least 4 hours before you deliver. So that can always be a question if it's like, multiple babies, like third baby, and you live far away, that can be a problem. But otherwise, it's not usually an issue. But you will definitely need an IV to get those placed. I do not have anything to share about progesterone. Sorry, guys. You're welcome, Ray. If I got induced on my first pregnancy, will it change anything for the second pregnancy? I'm 37 weeks, by the way. It depends on why you were induced. Like, will it change your labor? No, I don't think so. Like if you were induced for a specific reason, now that may end up happening again. It also may not. So yeah. If you guys have more questions, let me know. Back to things people felt like helped them had a better birth is to not get overwhelmed by birth info. Tell me in the comments if you've seen those marathon Saturday birth classes. Like I'm always like, wow, that is a lot to go in for 6 hours or 8 hours on a Saturday. And we just like throw birth at you. And so a lot of people really enjoy just kind of taking it at their own pace, kind of getting little bite-sized bits of birth along the way. Bite-sized bits of birth. Maybe I should change my class name to that. Yeah. So not getting overwhelmed by information. I think that's why people like learning on social media. And that is actually why in the online prenatal class for couples, I made the videos just 20 minutes long so that you wouldn't have to get overwhelmed with information. You could just watch 20 minutes, chitty chat about it. There's couples questions in there and then move on. You can watch it over dinner or whatever. Maureen asked, when is it safe to drink raspberry leaf tea or midwives brew? You can drink, I don't know about the safety, but raspberry leaf tea has not proven to put people into labor. I don't know if it's proven to do anything else. And I do not recommend midwives brew. So I don't have anything to say about that because it can be unsafe for mom and baby. Mom can sometimes get super dehydrated through the diarrhea that it causes. And it can sometimes make baby have those issues as well. And they poop in the womb and that's not good. And just from patients who have seen deeply regret taking castor oil, the end. Signs look out for uterine infection. I have a high fevers, chills, pelvic pain so bad, 22 weeks. You think you have a uterine infection? Does your belly hurt? If that's the case, I would definitely talk with your provider. And I think that would be a reason to even call them maybe after office hours have closed. That sounds not so good. Cherie said she definitely regrets taking castor oil. Yes, because it just makes you poop and poop and poop and poop, like liquid poop. Just poop and poop and poop. And people are so embarrassed because sometimes they poop in the bed while they're contracting. They have we're prepared for that, but they have no control over it because it just basically irritates that part of your body. And then I feel like your uterus is like, well, if the intestines are angry, maybe we'll get angry too. I don't know why it starts anything, but it's miserable. I don't know anything. Oh, we have a couple Cheries. I don't know anything about Provera. Sorry. All right, let's talk about some other things that people loved about getting prepared for birth. I think the other thing is you got to take care of you while you're getting prepared. So what's going to work for you? I taught birth classes for my hospital, and people were miserable in those evening birth classes. They were tired after work. They were starving. They were embarrassed to be eating, even though I was like, please eat, please eat. Bring all the snacks, bring all the food, please eat in this class. Because I don't eat pregnant people hungry. No. So and then sometimes, the other partner couldn't be there. It was just miserable. And I felt so bad for them. So make sure that you're taking care of you for a birth class. It is honestly why I started an online class, so that you could take it whenever the heck you wanted. And you didn't have to like mesh busy schedules with your partner, because my husband and I have such a hard time doing that when we were both working full time. It was difficult. So yeah. I watched so many birth vlogs. It helped to know what vibe I wanted, what could happen. That's awesome. Although I do recommend taking a class that goes from beginning to end, because it's really easy to miss something, right? You don't know if you've missed learning about C-sections. You don't know if you've missed something else. So birth vlogs can be helpful, but I just think they're a great addition to also taking a birth class that you understand everything. Yeah. I don't know what that means. Let's see. Thank you for the gifts, guys. That's really kind. I don't know. I don't know what they do for me, but I appreciate it. Let's see. What other things do people do? They started early. So often people were like, well, I'm not going to start a birth class till I'm like 35 weeks, but that's such a mistake, because I recommend starting it usually like third trimester. So getting your class when you're about 20 weeks, and then starting it, as you had like a month later. But you can start it whenever you want when it's an online one, because you can always go back and review it. And my friend Amber found that starting early helped her really feel prepared, because she was able to review it, really indoctrinate herself into how she was going to get prepared for birth. And so I always recommend starting earlier rather than later as you prepare for birth. What does sharp pain in the lower abdomen mean, Mamie? It could be ligament pain. It could be a bladder infection. It could be contractions. Usually contractions aren't defined as sharp. Yeah. Are we talking about colostrum collection? I feel like that's gotten almost out of hand. Like I'm seeing people with just like bags and bags of syringes, and you're not going to end up using that much. So, and I just feel like your time would be better spent maybe relaxing. I'm a big fan of collecting maybe 5 syringes in case your baby needs colostrum at the beginning. But yeah, in the beginning, we really want baby to be suckling at the breast. So yeah. What allergy medicine is recommended, especially when you're early in your pregnancy? I can't recommend any medication. Sorry, that's above my pay grade. Why didn't contractions hurt me that bad? I went fully natural. It was the Xanax they gave me. I've never given somebody Xanax in labor, so I do not know. 6 weeks, no heartbeat on ultrasound. Is that normal? We've already actually discussed that. That happened to somebody else in here. Also, it can be normal because baby might be too small. So maybe baby might be a little bit small, and then you'll check again in a week, and maybe there will be a heartbeat. It's hard to know. Yeah, a lot of people like the Haka, which is like a little sucker that you just like stick on there. But I for me personally, and the lactation consultants that I've talked to, you guys know that I love the Breastfeeding Mama. She teaches the breastfeeding portion of the online prenatal class for couples. She just is like, it's great to have a few syringes, but don't focus on it. There's so many other things to focus on during pregnancy. Do that. They gave me Xanax to relax me so I could get my IV. I'm terrified of needles. Okay, interesting. I've never given Xanax for an IV, so yeah, I don't know. Let's see, what other things do people find that help them to go with the flow? This is one of my big ones. So I think it's important to have a birth plan, but also be ready to go with the flow. Tell us in the comments if you've created a birth plan. If you're looking to create a birth plan, I do have a freebie, like a little class that you can take. You can find it under resources on my site. It's a free resource, and a lot of people find it super helpful. Yeah. Would anything be visible on a 5-week ultrasound? Usually you can see a fetal sac, and that's it, I believe. I'm not an ultrasound person, so I don't know. Kale said, same Barbie, getting the epidural scares me. I don't know why they didn't show your comment, Kale, but yeah, a lot of people get nervous with it. Somebody said pros and cons. Hard to say what that is. Anyway, making sure that you go with the flow, I think, is so important in labor, not to be tied to anything in particular, but being willing to adjust as you go and making sure that you take a birth class that allows that. I was talking to another childbirth educator and she was like, all the people who feel disappointed in themselves for getting an epidural. And I'm like, who's feeling disappointed in themselves for getting an epidural? I have honestly rarely seen that, but I think it might happen if you had the birth class that was like tying you to a natural birth that said that acted like that was somehow better. As Maya said, I'm trying too hard to get pregnant. I obviously have regular periods. I don't know what I'm doing wrong. I don't know. Check with your provider. It is average 9 months to get pregnant. Kendall said, when to worry about high fevers, 103 and upward. Yeah, I would talk with your provider. That's too high. Crystalline, no birth plan, just go with the flow. I knew I wanted to be calm and just be able to decide as needed. That's awesome. I love a birth plan in the fact that you've even thought of it, because sometimes people come in, I'm like, do you know if you want the baby meds? And they just like blink at me like, what baby meds? Do you know who your pediatrician is? They just like blink at me. They have no idea that baby needed a pediatrician. So even sometimes just like the basic questions, it's just nice for you to have an idea of like, well, I think I'd like to go without an epidural, but if I need one, I'm here for it, right? Yeah. Sunflower child, I lost my twins at 20 weeks. Oh, I'm so sorry. I'm sorry, Sunflower child. That's horrible. Okay. The other thing is to find someone with lots of experience. Sometimes people take birth classes with people who just have, they're like a childbirth educator who really hasn't seen that many births, a doula who maybe hasn't seen lots of births, or especially like when birth goes like awry a little bit, like C-sections. A lot of doulas don't do inductions, or they only do natural births. They're not used to epidurals. So make sure that you're taking a birth class with somebody who has lots of experience from a big span. People who took my class found that to be super helpful because they knew that they were getting somebody who had seen lots of different things. Yeah. I won't be talking about pregnancy tests in here. Sorry, guys. 14 weeks today with first child has been rough, not gonna lie. Sky, you're heading into the good zone though. So hopefully you start to feel better now. Is lightning crotch normal at 5 weeks, 9 weeks, 5 days? It can be, but I would mention it to your provider just so that they have a heads up. Another thing that I think is super important to do, because a lot of people are getting prepared here on social media. Somebody mentioned watching vlogs and they're just doing it that themselves. Like your partner is not like watching all the birth vlogs with you, most likely. Maybe they are. God bless if they are. But you need to get prepared with your partner because they can really be an advocate for you in the hospital. When you're in pain, they can be the one who is like, no, she really wanted this. Or, when you just start to have big eyes and blinking at us because you're hurting, they can be the one that's like, oh, I have the pediatrician number right here, right? Carla said she's getting induced tonight at 8 p.m. Carla, it's so soon. Good luck with everything. Spotting can be problematic. It's hard to say. Talk with your provider though, okay? 10.5 percentile. Usually I don't think they worry until it's a little bit lower than that, but I'm not really sure. Kelly, did you ask your provider what they thought? I've got to say that learning to talk with your provider is also so important. So like Kelly talked about in here, sometimes providers will just be like, well, baby's measuring 10.5 percentile and just like end the visit. And learning to be like, okay, what does that mean? What does that mean going forward? Like, what is the next test that we're measuring, right? Really learning to talk with your provider to get the information that you need, because I got to say some of them are a little tight-lipped and they aren't giving you everything that you need. Yes, Crystalline said, highly recommend a partners class for them to learn how and where to help in different positions. Yes, although I actually don't recommend a separate class for your partner. I recommend just doing it all together so that you guys can have that conversation the whole way through. I gotta admit, though, a lot of people probably watch my videos more on their own and then bring the partner in. I do have friends who the partner only watch the key point videos. Either way, yeah, anything you can do to get the partner involved, I'm a big fan of. And then my other tip was to don't forget your third trimester. A lot of times birth classes don't start until labor starts. And I'm a big fan about learning third trimester testing, NSTs, AFIs, BPPs, all those different things, what they are, what you learn from them, and how to move forward after that. Again, talking with your provider. is going to be so helpful. So take a birth class that still is going to help you during pregnancy. I always say the online prenatal class for couples covers the rest of your pregnancy, labor, birth, postpartum life after baby. We cover like the first couple months after baby is born. So you want to get a class that covers all those different kinds of things. Leanne said, I had my baby Saturday. It took me an hour and a half to have him with a precipitous labor. Oh, Leanne, how are you doing? A lot of times people find that to be crazy town. Crystalline said, yes, a partners couples class. LOL. Yes. I think it's weird. I don't know my husband would have ever done like a birth boot camp that they have. Guys, my son is making dinner for me over there. Someday that happened to you too. Anyway, yeah, huge fan of the couples class. I think that is so important. A lot of times I see just like mini classes often for partners or like just a separate class. And I can't encourage you anymore to both get prepared together so that you're on the same page. Sky said, you're so right. I had so many questions in my appointment, but was in and out so fast. Yes. So make sure that you are writing down your questions either in your notes app, or I have a pregnancy planner where you can write down your questions as well. So important. Crystalline said mine is 2 and he's crazy to think how fast he'll be making me dinner. Yeah. Someday. This one is 20 though. So he better make me dinner. Leanne said, I'm doing great. My stomach feels weird, like empty. Yeah. Leanne, so a lot of times precipitous labor, those people just feel really traumatized by how things happened. I had a friend who was really traumatized by her. So I'm glad that you don't have that issue. I will say that as a nurse, I'm always like, if you're having a precipitous birth, that means everything is lined up and things are going good and everything's going to be fine. That's what I always told myself as a nurse delivering patients who were having precipitous births. So hopefully it makes patients feel better as well. Lucy said, when should you expect your period after birth? Would low-key stop before it happens? It does, Lucy. It really varies depending on what's going on. If you guys had your period after your baby, tell us in the comments. Because like I didn't get mine until like baby was like 9 months old. So I have no idea. I have no idea why. So, because I also didn't even breastfeed. I'm probably a mess. I'm 20. My husband and I are thinking about kids. Are people judged for coming in at 20? I don't think so, Haley. If you are in a great supportive relationship and you want to have kids, then I say do it. I had my babies early. My first one was at 24. I see a lot of benefits to having your baby early. I see a lot of benefits to having your baby late. I just think it's kind of when you're ready in your life. Why won't my OB check me when I ask her to? Not high risk, third baby. I'm 38 weeks. Can she deny me? I mean, I guess she can. You can't make her check your cervix. I do think that's sort of odd. Maybe she just wasn't prepared for that. Super busy in the office. It's the only thing I can really think of. But I would just say that you're curious and that you would like to know. And then usually they will check you if you ask. So that's kind of interesting. Even say, I'll change. You can have your next appointment and then come check me so that it doesn't like mess things up. Yeah. Leanne said, I feel a little off, like dizzy at moments. Make sure that you're not bleeding though, Leanne, because it will say that precipitous births can have increased bleeding. So watch that. Crystalline said she had hers at 8 to 9 months after stopping pumping at 7 months. Miss Lovely Ray said, hypertension and gestational diabetes. What can I do? I mean, you just want to follow the doctor's orders as well as you can. And I know a lot of people get frustrated because their diabetes blood sugar levels aren't what they wish they were. But there's really only so much you can do. A lot of it is the placenta just weirding your body out. So hang in there and be kind to yourself, Miss Lovely Ray. Okay, so Crystalline didn't get checked to reduce risk of infection. I don't know if I believe that. When do you get your last ultrasound? I'm currently 36 weeks and my appointment is on Friday. They really actually only recommend 2 ultrasounds, the early one to check for your dates, and then the second one for anatomy. And then if you have anything after that, it's usually because you're high risk or they're noticing something's off. So a lot of people only get 2 ultrasounds. And don't get a later one. I didn't get a later one on my first or second pregnancy. When should I stop birth control without planning a pregnancy? I think gotta ask your provider. I don't know. I'm not that great on the whole getting pregnant part. Hello, in case we haven't met, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I'm the creator of the online prenatal class for couples, the easy way to get prepared for birth. In this live, we've been talking about ways that couples found that preparing for birth helped them to have a better birth. I would love for you guys to join me in there. If you have any questions about my class, I would love to answer them in the comments. We will be wrapping up this live soon. If you have any other questions, now's the time to shove them in there. Mariah said, any advice on what vitamins up to on 2 miscarriages and 7 years of infertility and counting? Anything or to do at home or help my changes? I'm sorry, Mariah, that is tough. I don't have any tips, although I was re-listening to one of my podcasts where somebody tried spearmint tea and it seemed to help her conceive. So I don't know. Hang in there. Make sure you're talking with your provider and stay in close touch with them, Mariah. Make sure you've had the basic labs because there are some basic labs they can check. I'm pregnant with my third. First 2 were natural, so scared of needing a C-section this time around. There really isn't a reason to be scared of it. If it happens, hopefully you're prepared. Alyssa, I always recommend even second-time moms take my basic birth class so that they're prepared for all of it, any changes, and also going over, anything that's changed since they had their last baby. So I do recommend it even if you've already had a baby. Everyone's like, oh, it's my second baby, I don't need one. I mean, that's always up to you, but I still do recommend it. And I have so many people who take the class and are so glad that they did, because a lot of times it takes any birth trauma that you had with your previous ones and really processes it so that you understand. Signs of preterm. I have 34 weeks, second baby, back pain, nausea, diarrhea, dizziness, headache. I don't know. Have you talked with your provider about those symptoms? Those don't seem honest. So they don't seem awesome. So I would be a little bit worried. Yeah. My blood pressure has been high. I don't have preeclampsia. Will they possibly induce me? I've never had high blood pressure before. They will sometimes induce for prenatal or pregnancy-induced hypertension. I don't have any tips for hyperemesis. Sorry. Talk with your provider about if there's anything that you can take. But Adriana, if your blood pressure is high, they should be considering putting you on medications for that as well. Mariah said she can't afford $6,000. Yeah, Mariah, I didn't ever go for infertility as well, but a lot of times your insurance will cover the basic labs. That's not like infertility. Yeah. All right. Any more questions? Last call for questions. Just a reminder. Hi, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience. I sure appreciate all the people that have followed me on this live. I love all the questions. I love hanging out with you guys. I hope that everybody has a good night. It looks like we got all the questions answered, and I would love it if you would come join me in the online prenatal class for couples. You can find it through my link. We have 2 options. The first one starts at $89, and the second one that includes breastfeeding, nutrition, baby care, baby sleep, elective inductions, partner tips, all sorts of things, stages of labor. That one's $197. So if it's your second baby, I totally recommend the basic class. I think that's plenty, and I think you're really going to enjoy it. Anyway, thank you guys for joining me. Thank you for the follows. I hope everybody has a good night, and we will talk with you later.